The book provides readers the insight of the life in the slum of Mumbai, India. It shows the vivid picture of various struggles and hazards associated with extreme poverty. That poverty makes millions of people live in dangerous conditions, and every day they have to struggle with that conditions physically and mentally.
Some of the dangers of poverty include health deterioration and diseases such as tuberculosis, malaria, and yellow fever, lack of education, high unemployment rates which resort to dangerous labor, and lack of sanitation which causes the spread of disease and pollution.
In Behind the Beautiful Forevers, there is a big connection between the poverty within life in the slums and health outcomes. There is constant infection and respiratory issues along with poor quality water available. The living conditions often contribute to the occurrence of disease, as most slum dwellers don't live in sanitary conditions nor have safe water. Tuberculosis is the biggest health condition portrayed throughout the book and is one of the main causes of death among those living in the slums. Abdul's father, Karam, is constantly in the hospital and unable to work due to his debilitating tuberculosis. This is just one example of the many that have been affected by the diseases prominent in the slums.
One of Behind the Beautiful Forever's most prominent themes is widespread corruption at every level of government involvement. Government schools close down as soon as funding money is diverted to individuals. Judges can be paid off during court cases relatively easily, and doctors will lie about things such as the age of a patient in return for a bribe. Politics at all levels are run based on corruption, right down to the social ladder that one of the characters, Asha, climbs to become a slumlord.
Environmental health is key to increasing quality of life, yet half of the greater Mumbai population live in makeshift housing, and those homes pose significant dangers to the population's health. Indoor air pollution from wood-burning stoves, overflowing public toilets due to poor plumbing, unregulated power lines, and lack of arable land increase the likelihood of exposure and disease.
India needs support and assistance in implementing health policies to help the poor and increase the amount of aid. Ministries of health, governmental departments, donor organizations, and the community must collectively work together to improve the health of the poor citizens. The book Behind the Beautiful Forevers gave us insight to life living in extreme poverty. Community members are dying, getting injured, and suffering due to the hazardous conditions they live in.